A pulmonary embolism is a serious condition that occurs when a blood clot blocks one of the arteries in your lungs, often originating from the legs. We'll break down the key risk factors that can contribute to the development of a PE. So let's get started. 1. Deep vein thrombosis. The most common cause of pulmonary embolism is a blood clot that originates in the deep veins of the legs, known as deep vein thrombosis. When a blood clot forms in a deep vein, it can sometimes break loose and travel through the bloodstream to the lungs. Once it reaches a pulmonary artery, the clot blocks blood flow, resulting in a pulmonary embolism. 2. Immobility or sedentary lifestyle. Extended periods of immobility, whether due to long flights, bed rest after surgery, or extended hospital stays, can increase the risk of DVT and, consequently, pulmonary embolism. Lack of movement slows blood flow in the legs, which makes blood more likely to pool and form clots. 3. Surgery and trauma. Surgery, especially major procedures such as joint replacement, abdominal surgery, or cancer surgery, is a significant risk factor for PE. During surgery, blood vessels can become damaged, and patients are often immobile for extended periods during and after the procedure. These factors make blood clots more likely to form. 4. Genetic and blood clotting disorders. Certain genetic and blood clotting disorders can make an individual more prone to forming clots, thus increasing the risk of both DVT and PE. Conditions like factor V Leiden mutation, prothrombin gene mutation, and deficiencies in protein C, S, or antithrombin 3 are all associated with increased clotting risk. 5. Cancer and cancer treatment. Cancer, particularly cancers of the brain, ovary, pancreas, colon, stomach, and lung, increases the risk of blood clots. Some cancers release substances that make blood more prone to clotting, and cancer treatments like chemotherapy and radiation can also contribute to clot formation. 6. Hormone therapy and birth control pills. Hormone-based medications, including hormone replacement therapy and oral contraceptives, can increase the risk of blood clots. Estrogen, a common component of these medications, increases clotting factors in the blood, making clots more likely to form. 7. Pregnancy and postpartum period. Pregnancy places extra pressure on the veins in the pelvis and legs, which can slow down blood flow and increase the risk of clotting. Hormonal changes during pregnancy also make blood more prone to clotting. The risk remains elevated in the weeks following childbirth, especially if there were complications during delivery. 8. Obesity. Obesity increases the risk of blood clots and pulmonary embolism in several ways. Excess body weight puts extra pressure on veins in the legs, which can slow blood flow and lead to clotting. Obesity is often linked to other risk factors, such as a sedentary lifestyle, high blood pressure, and diabetes, which compound the risk of DVT and PE. 9. Smoking. Smoking damages the lining of blood vessels, making them more prone to clotting. It also reduces oxygen levels in the blood and promotes inflammation, which can further contribute to blood clot formation. Smokers, especially those who also use hormonal contraceptives or have other risk factors, are at an increased risk of DVT and pulmonary embolism. 10. Age and family history. The risk of pulmonary embolism increases with age, as blood flow tends to slow down and blood vessels may weaken over time. Additionally, people with a family history of blood clots or pulmonary embolism are at higher risk due to genetic factors or shared lifestyle habits that promote clotting. Pulmonary embolism is a serious medical emergency that often stems from deep vein thrombosis or other conditions that promote blood clotting. Knowing the causes and risk factors is critical in taking preventive steps. Regular movement, lifestyle changes, and early medical intervention are key measures in managing and preventing pulmonary embolism. If you found this video helpful, please like, subscribe, and hit the notification bell so you won't miss future content on health and wellness. Stay healthy, stay proactive, and we'll see you in the next video.